A quality minute with Cole Beeler. With the recent increase in COVID cases in August of 2023, I've been getting a lot of questions about getting another COVID booster. I'm going to talk through my thoughts in this quick presentation, but would note that these are only my opinion based on the data. You may come to an alternative opinion. That's fine. If you want to get a booster, great. If you don't want to get a booster, it's hard for me to argue with you. Just don't work if you're sick and wear a mask if you're unsure. I'm not going to apologize too much, though. Avoiding discussions on this topic is a missed opportunity regardless of where you stand. To frame the debate on boosters, it's important to define what we're expecting the booster to affect or prevent. Is it any PCR positivity, even in asymptomatic individuals? Is it prevention of transmission to others? What about reduction of symptoms or hospitalization or death? What about the dreaded long COVID symptoms that so many people report through the Delta wave? Let's look at what we know and don't know about the current state of COVID vaccines. We know that the vaccine has lost effectiveness at helping to avoid transmission when it shifted from Alpha to Delta and then again from Delta to Omicron variants. This was also associated with loss of vaccine effectiveness in protecting against acquisition. So in effect, the vaccine protects less against getting the virus and giving the virus than it previously did. It's not zero chance of protection, it's just less. There are no absolutes in infection, and people who use them are usually pandering. If you give a booster, you probably reduce the risk of passing on COVID, even during Omicron times. But the chance of passing it on doesn't go down to zero. So, can a boosted individual pass COVID to someone? Yup. If you're worried about transmission, you really can't assume, booster or not, that the people around you can't get COVID from you. The booster reduces the amount of transmissions, but at an individual level, you really can't change your behavior if you're attempting to avoid all transmission events just because you got a booster. Now, boosted patients have a 20 to 40% reduction in symptoms if they get infected. This reduction is more potent for younger, and if it's been longer between your booster doses. I would note that this data is from last winter, and I just don't know if we'd see the same degree of reduction of symptoms today when severe symptoms are so rare. COVID has already proved it can change its epidemiologic presentation throughout the course of this pandemic. When looking at a more recent cohort, but certainly not current circulating strains, we see that boosters help prevent hospitalization. This is more potent in patients who are at higher risk for hospitalization, like unvaccinated men with other medical comorbidities. All this data on hospitalization is focused on those older than 65. I just don't know for people less than 65. But can an extra shot save your life? Maybe. In this study, a bivalent booster was better actually than a monovalent booster at preventing a composite of hospitalization and death when compared to completely unvaccinated individuals. The caveats here are that the endpoint was either hospitalization or death, not just death. So I don't know how much does it actually reduce death alone. Data related to death on COVID, it showed that it's actually pretty rare if you're less than 65. You actually have a higher chance of dying in a car accident, but that doesn't mean that we shouldn't try to avoid it. I'd also say that mortality benefit likely wanes with time. After 3 months, I'm not sure you're getting the same bang for your buck. Does this support quarterly boosters? What about weekly boosters? Man, I hope not, but it doesn't make sense. Another thing that gets a lot of press is long COVID, those persistent symptoms that are very common after more severe disease, which can last months afterwards. Interestingly, vaccine boosting before COVID and even after a long COVID diagnosis may reduce long COVID complaints. Now, the effect here is relatively small, around 30% reduction, but it's worth considering. I'm not confident, I know, if this is still applicable today, since we've been seeing so much less long COVID with Omicron. Which brings me to another important factor to consider, which is the current prevalence of the outcome that you're trying to avoid. We are seeing an increase in COVID cases in Indiana right now, but I don't know what this wave is going to look like right now. It could be bad, it could be mild. Thankfully, we know that the amount of severe disease associated with hospitalizations and death is still very low, especially when compared to Alpha, Delta, and Omicron surges. Any data on COVID should be taken with a grain of salt. First, I don't know if data from Delta applies to the current circulating strain. Therefore, I don't know if benefits related to a booster are as effective as they once were when they were studied. I also don't know the speed at which the booster benefits wane with time. It's probably different for each person. Would you be more likely to be boosted if I told you it prevented hospitalization over the next 3 months? What about over the next month? Next, I don't know how natural infection plays into this equation for risk reduction, but from everything we know, natural infection seems at least as good at meeting outcome endpoints as a booster. Do you really need a booster if you just got over COVID? Lastly, and I should preface, I am overall pro-vaccine, but I'm also not willing to ignore some of the harm that vaccines could do. Rates of myocarditis and clot are very low, probably even lower than getting COVID itself, but they aren't zero. And there's probably an association. You're drinking the Kool-Aid if you think this shouldn't be factored in. Promotion of safety should overwhelm the risk. I think that's the case here, and I think the vaccine is overall very safe. But is the yield in a 24-year-old male the same as a 72-year-old female? Definitely not. So if you come up to me and say, yo, Beeler, should I get a COVID booster? I'd say, it really depends on your age, risk factors, and the local epidemiology, knowing that as soon as you get it, your duration of benefit is time limited. But I'd encourage you to talk to your primary care provider about your individual risks and benefits. Truth doesn't change, but our understanding of it does. We gotta adapt over time. To science.